For the best in eyewear, call Dr. Leak's Optometry.
Just because your child is learning remotely doesn't mean influenza is moving remotely. It is also still out in the community. It's not just in the schools. It's in in stores, at parks, and individuals around you. So we still expect influenza to continue to move from person to person and place to place.
Getting a flu shot is especially important to help reduce the number of hospitalizations this fall and winter to prevent overwhelming our healthcare system, which is already dealing with COVID-19. Dr. Frank Esper with Cleveland Clinic Children's says flu season is inevitable, but he hopes it won't be as bad, mainly because people are already following social distancing guidelines and wearing masks for coronavirus. He says children under the age of 2 are most at risk for flu, but it can also infect healthy kids of any age and sometimes lead to serious complications. As for how effective this year's flu shot will be, he says only time will tell, but regardless, it's still better to have some protection than none at all.
It really prevents how many people who do get influenza virus. If you got the vaccine, you're much less likely to get hospitalized. And so it may not prevent you from getting the flu. It does prevent you from ending up needing oxygen, from ending up being hospitalized, or even more so going into the intensive care unit.
Dr. Esper says children ages 6 months and older should get a flu vaccine. He adds that both types, shot and nasal spray, are acceptable.